Hey sir, I am your student nurse Niko and I am your nurse for today. May I ask your name sir?
My name is Brett Lau,
How old are you sir?
20.
20. How can I call you?
You can call me Lau.
Okay sir. So today sir, I am going to perform a head to toe assessment. Is that okay with you sir?
Okay.
Yes. Cut now.
Go. And go.
And now sir, we're going to take your temperature, your pulse rate, and your respiratory rate. So, kasi ni stock sa imo nga, sir. Okay, wait, magawa ta sa muting, sir. Atong pa ng mga pulse rate. Alright, so, um, your temperature sir, is 37 degrees Celsius, which is normal. And then, your pulse rate is 66 beats per minute. And then your respiratory rate is 19 breaths per minute.
There you go.
And now we're going to get your blood pressure. So first is stethoscope. And then let's also take your brachial pulse. One ten over 60. That's it.
Hmm.
And today, sir, I am going to assess your skin, hair, and nails. So first, let's inspect first your skin. Um, the odor, good, and the color, um, the lesions, textures, and the temperature, the thickness, mobility, trigger, and edema.
Start.
And now, sir, we're going to assess your scalp and hair. So, let us check the color, the amount, the distribution, the thickness, the texture, and the lesions or the parasites. Good?
Okay.
And now we're going to assess your nails, the grooming and the cleanliness. So first, let us check the color, and then the texture, the shape, the consistency, and the capillary refill. Good?
Go.
And now we're going to assess your head and your face. So first, we're going to inspect your face. So let's inspect the size and the shape. Okay, it's normal. The configuration and the consistency, it's good. And then the symmetry. So sa akong nakita, balance yung mga announcer or symmetrical na yung mga face. And then it's good. And then the facial features and your expressions. So far, it's normal. And then the skin condition of your face. Wala ka lang no sponsor, it's good. Sakto na siya. And then your hair distribution, it is well distributed. And the color also is normal. So, and now sir, we're going to palpate your head, your temporal pulse, and your masseter muscle. So, first, we're going to palpate your head. Next is your temporal pulse. Next is your masseter muscles. It's good. And then now, next is we're going to inspect your joint mobility. So, can you open your mouth, sir? And then, can you close your mouth? And then, it's good. And then, can you open your mouth, sir? Let's check the sides of your joint mobility. It's good. And now, we're going to assess your cranial nerve number 5. So, first, so karon sir, nakoy duha ka object, the soft and the hard, ay the sharp rather. And then let's test your sensation. So karon let's start first sa soft na object. So tell me sir if naka-feel ka ani nga object. Tell me yes if naka-feel ka. Can you please close your eyes?
Yes. 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 Yes.
Good.
Yes. Yes.
Okay, that's good. And now we're going to use the sharp object. So tell me if naka-feel ka sa sharp na object. Tell yes.
Yes. Yes. Yes. Yes. Yes. Yes.
Okay, that's good. And now, um, atong i-combine ang duha sir, and then atong i-test kung maka-identify ba ka if it is soft or it is sharp. So tell me if it is soft or sharp.
Soft. Sharp. Soft. Sharp. Soft. Sharp.
Okay, that's good. And now we're going to test your distant visual acuity. E F B E O Z L E E D E E C F D E E F C F E. And now we're going to test his um, near visual acuity. E F B E over your eye, Z N P E D E E C F D E D F C C P F E L O P C T D E F F O P E C L E. So now, sir, um, can you cover then? Can you trace the color green here? Okay, that's good. Now, can you trace the color pink and that orange? Okay, that's good. And now, sir, going to trace again here the color orange. Okay, that's good. And now you're going to trace the color green here. Okay, very good. And now you're going to trace again the color yellow and orange here. Okay, very good. And now you're going to trace the color green and yellow green. Now you're going to trace here the pink and the orange. Can you do it, sir? Alright. So here, sir, you're going to trace the color orange alone. So can you do it, sir? Okay, very good. So it means that the patient is able to trace and identify the numbers. So it means that his color vision is intact or functioning. So and now we're going to test your visual field. So I have here a pen light, sir. And then you're going to trace the direction nga akong ihatag. This is to test your visual field. And now, can you do it, sir? Alright. Here. So, and now we're going to test your extraocular muscle functions. And now, let's test first the corneal light reflex. So let's use the pen light. Can you open your eyes, sir? Open your eyes. So and now, sir, we're going to perform the cover and uncover test. So can you please cover your right eye, sir? Okay, and now uncover your eye. Okay, then cover again your right. Then uncover your right and cover your. And now we're going to assess your ear. So first, let us inspect the external ear structures, the auricle, the tragus, and the lobules. Okay, let's inspect the size and the shapes. Let's inspect also the position of your ear, if there is any lesions or discolorations. Okay, good. If there is any discharge, swelling or redness. So It's all normal. And now, we're going to palpate your auricle, your tragus, and your mastoid. So now we're going to um, palpate your auricle. Now next we're going to palpate your tragus. Next we're going to palpate your mastoid muscle. Okay, let's do it in the other side, sir. Can you please there? Let's palpate your auricle again, your tragus, your mastoid. Let's check for if there is let's check for the tenderness, if there is any masses. Color. So the color is normal. There is no lesions. So as I palpate his ears, the patient wala siya ni reklamo og sakit. So it means that his ear as I palpate is normal, or there is no any masses na ako na-inspect. And now we're going to perform the otoscopic examination. So let's inspect ang imong external auditory canal using the otoscope. Let's check for the discharge, the color, and the consistency of the cerumen. And then let's check again the other side. Let's check again the color, the cerumen, the color and the consistency of canal wall. If there is any nodules, so there is no abnormalities as I inspect. And now we're going to examine your tympanic membrane. So let's do it here first. Okay. Let's check for the color. So far it's normal. The shape, the consistency, the landmarks, and the Valsalva maneuver. Alright, so let's do it again here on the other side. Let's check for your tympanic membrane, the color, the shape, the consistency, the landmarks. All right, so as I inspect his tympanic membrane and his external auditory canal using the otoscope, there is no abnormalities and all are normal. So that's it. And now we're going to perform the hearing and equilibrium. So first, we're going to perform the voice whisper test. So now, sir, I will cover your left ear, and then I have something to tell you, and then as I whisper, you're going to listen and then tell me if kung unsa akong gisulti. Is that okay with you, sir? Alright, so here we go. Boy. Good. Good. Okay. So his ear, as I perform the voice whisper test, so his ear is functioning very well. And now, sir, we're going to perform the Romberg's test. So what you're gonna do is that you're going to put your arms like this. Do it, sir. And then you will you will stand up. Okay, alright, so can you do it again, sir? Can you put your hands down and then go perform the then stand up. Alright, that's good. So it means that the patient is able to um, put the balance. So now, that's it. More days. So now we're going to perform the Weber's test. So here. So can you feel the vibration, sir? So now the patient is able to feel the vibration. So it means that his ear is well functioning. And now we're going to assess your nose and your sinuses. So first, let us um, inspect and palpitate your external nose. So the color is good, the shape is normal and the symmetry, and then the tenderness, the patency, it's all normal, and then let's palpitate your sinus ear. And now we're going to inspect your internal nose. So, sir, the color, it's good, and then there's no swelling inside. Wala sa mga nakita nga bleeding or ulcers, and then the polyps, wala pa siya, so it's all normal.
Okay.
And now, we're going to assess your cranial nerve number 1 or the olfactory nerve. So, karon sir, nakoy pasimot nimo nga something, and then you're going to close your eyes and then imo kong sultian kung unsa ni siya nga odor. And now, close your eyes. Tell me what's the odor.
Perfume.
Yes, that's good. It's perfume. So that's the cranial nerve number 1 is intact. And now we're going to assess your mouth and your throat. So first, we're going to inspect your mouth. Let's inspect for your mouth odor, huh? And now let's inspect the lips. Okay, it is pinkish, which is normal. The buccal, mucosa, and your gums. Let's check. Let's check for your gums. Okay. And now let's check for the color of your gums, the moisture, the consistency, if there is any lesions. So as far as I can see, there is no abnormalities or lesions. And now we're going to inspect your teeth. Can you open your mouth? Inspect for the number of the teeth, the color. So it is yellow, which is symbolizes as strong. The shape of your teeth, and the occlusion. And now we're going to inspect the hard and the soft palate. Can you open your mouth? So the color is normal, which is pinkish red. There's no swelling inside. Can you open your mouth again? Now let's check for the uvula, the color and the tenderness. Can you open your mouth? Okay, the uvula is color pinkish red, which is normal. That reflects. Now again, we're going to inspect your tonsils. Can you open your mouth again? Let's check for the color of your tonsils. If there is any lesions, so there's no lesions, there's no swelling, and that's it. So there's no abnormalities inside his mouth. And now we're going to inspect and palpate your sinuses. So first we're going to inspect and palpate your sinuses. First is your frontal sinuses. Let's inspect and palpate. Okay, it's normal. The transillumination here. And last is your maxillary sinuses. Now let's palpate for the tenderness. So far it is normal. Yes. Now let's percuss the tone of your sinuses. Let's check for the color, the consistency, the moisture, and the size. So far, the patient has a normal sinuses. There's no abnormalities. And now, we're going to perform. We're going to palpitate. We're going to perform the cranial nerve number 12, which is the tongue strength. So can you please open your mouth, sir, and then can you move your mouth outside? Then move your mouth. And move your mouth here. Shake your mouth. Okay. So the patient is able to move his mouth. There's strength in his mouth, in his tongue rather. And now let's palpitate your lips if there is any lesions or the consistency, the color. So far it's normal. And now we're going to palpate your tongue. So can you please let us check the color? If there is any lesions, swelling. So far as I can see, the color is pinkish red, which is normal again. And now we're going to perform we're going to test the cranial nerve number 7 and number 9. Now, nako'y pasimpot mo, sir. And then you're going to tell me if it is salty ang odor or yes, you're going to tell me the odor.
Sweet.
Again?
Sweet.
Okay, that's good. So it means that his cranial nerve number 7 and number 12, number 9 rather, is intact. And now we're going to assess your neck. So first, sir, let's inspect your neck. So the movement of your neck, let's check, and then hangad, sir. Look po, and rotate. So good, sir, and then karon um, we're going to check your lakeya, sir, kung nasan to, naba siya sa midline, na center ba siya, and then ato i-check kung naba siya gaburot or masses, kung naba yung swelling or something nga gapuha. So good, sir, ako nakita. And then karon, sir, we're going to check your jugular vein. So i-position ka into 45-degree angle, and then atubang na ka sa right. And then so far wala ko nakita nga vein nga gaburot. So that's good, sir. I-box lang.
Go.
And now, sir, we're going to palpate your lymph nodes. So first, the pre-auricular, and then second, the post-auricular, behind your ear. That's good. And then third, the occipital. Fourth is the submandibular. Anad, sir. And then next is your submental. Good. And then next is your posterior cervical. And then lastly is your supraclavicular, or superior above your clavicle. So that's it.
Okay. Go.
So now we're going to palpate your thyroid gland, the anterior and the posterior approach. So hangata gamay, sir. Ato i-check, sir, kung normal na ba ang size ng mga thyroid gland. And then so far normal na siya, sir. Naka-feel ba kang sakit, sir?
Wala.
Alright, good. And then so far, sir, wala ko nakita nga gaburot, masses or goiter sa imo nga thyroid gland. So it's good, sir, nga normal na siya. And then karon, sir, we're going to auscultate your thyroid gland using the stethoscope. So ato paminaw, sir, ang imong thyroid gland if wala ba siya abnormality nga sounds. And then after ato auscultate na po balik ang imong mga carotid artery. So first, let's auscultate your thyroid gland. Ato paminaw. Mga gamay, sir. So far, sir, wala ko nadunggan nga abnormality nga sounds sa mga thyroid gland. So karon ato na pong i-paminaw lang imong mga carotid artery. Ano kami, sir? Gas. So far, sir, wala ko nadunggan nga abnormality. So that's good, sir, nga normal na tanan. And then that's it. Now we're going to assess your arms, hands, and fingers. So first, sir, we're going to inspect and palpate your upper extremities. So now, your arms. Let's check for the coloration. So it's normal, sir. Siya the tail, and then the texture, it's also good. And then the moisture, wala na dry ang imong mga skin, sir. And then the masses. Wala ko nakita ng masses sa mga arms. And then the lesions. So far, there's no lesions. And then the muscle tone. And now, we're going to inspect your nail bed. Give me your finger, sir. Let's inspect for the color, the shape, and then the configuration. Okay, that's good. It's normal. And now we're going to test your cranial nerve number 11 rather. So, karon sir, it's vakante ka. Can you face there? So, karon, I'm going to push your shoulder down, and then imong buhaton sir is opposite ka direction sir. Imong i-up ang imong nga shoulder. Sige sir ha, akong i-try. I-up imong shoulder sir. Okay, that's good. So it means that your cranial nerve number 11 is intact. And now we're going to palpate again your upper extremities. So give me your hands again, sir. So let's check for your the tenderness. Tenderness here again. Okay, that's good. And then the swelling. Nakita na swelling. The temperature. It's also normal. Let's palpate your epictrochlear nodes. And next, we're going to palpate your brachial pulse. Good. And then now we're going to palpate your ulnar pulse. Now we're going to palpate again your radial pulse. And then the muscle tone. Okay, it's normal here. It's normal also. And now we're going to palpate your joints, fingers, and wrists in the chata app. So give me your hand, sir. We're going to inspect the size of your fingers, your nails, the shape, if there is no swelling, and then the nodules and the masses. Here. So far it's good, sir. And now we're going to check your range of motion from your elbow, your shoulders, from your wrists, hands, and fingers to test your muscle strength and your reflexes. And now first we're going to test first your elbow, the motion of your elbow. Let's do the flexion, the extension, and then the pronation, and then the supination. Okay, that's good. It's normal. And then let's perform your shoulder, the motion of your shoulder. And now, sir, can you perform the internal rotation of your shoulder? And now, we're going to assess her posterior and lateral thorax.
Go.
And now, we're going to inspect the shape and the configuration, the position of the sculpture, the rate of the rhythm, the use of accessory muscles, and the client's posture.
Go.
Now, sir, we're going to assess your breast. So first, we're going to inspect and palpate your breast, sir. And now we're going to assess your abdomen. So first, sir, we're going to inspect your abdomen. Let's inspect for the color and the vascularity, the pigmentation, the straying, the scars, if there is scars. Let's inspect first. Let's inspect again your abdomen. Let's see if there is any lesions, rashes, or um, contour, and if it is symmetrical. And also, let's inspect your um, abdominal movement and your respiratory movement. Okay, good. So, wala ko nakita nga abnormality sa iya nga as I inspect, wala ko nakita nga abnormality. And now we're going to inspect again your umbilicus. Let's inspect for if there is symmetrical in your umbilicus, the contour and the color of the umbilicus. So far, it's all normal. And now, sir, we're going to auscultate the bowel sounds and the vascular sounds of your abdomen. So first, we're going to auscultate the bowel sounds of your abdomen. Let's see the intensity, the pitch, and the frequency. Okay, it's good. And now we're going to auscultate your vascular sounds of your abdomen. Um, the abdominal aorta, the renal artery, the iliac arteries, and the femoral arteries. So alright, so far wala ko nakitaan, wala ko nadunggan nga abnormality sounds sa iyang abdomen. And now we're going to percuss your abdomen. Let's percuss first the right lower quadrant of your abdomen. Good. Now we're going to percuss the right upper quadrant of your abdomen here. Good. And now we're going to percuss the right upper quadrant of your abdomen. And now we're going to percuss again. Lastly, your left lower quadrant of your abdomen. Okay, good. Now walay abnormalities, and now we're going to now sir, we're going to
Go.
and now let's assess her legs, feet, and toes.
Go.
And now let's inspect her lower extremities. Let's check for the skin color, the texture, and the masses, if there is any masses, the varicosities, the distribution of the hair. Let's check also, let's inspect if there is any lesions or edema. And the next thing we're gonna do is to palpate her lower extremities. Let's palpate for the skin temperature, the edema grade, so there is no edema at all. Next is the musculature and the pulses. Let's palpate for the popliteal pulse here. Next is let's palpate the dorsalis pedis here. Next is the tibial pulses.